So I'm going to talk about after-hours support for foster parents. So just to give you a bit of background, see if I can get this to advance. There we go. So our organizational structure, we are Municipal Animal Services. We're in Brampton, Ontario, Canada, and we serve a population of about 700,000 people, but we are one of the fastest growing cities in all of Canada. So currently overseeing our foster program would be one foster coordinator and our registered veterinary technician. So we would be the primary point of contact. We do have a 311 contact center, being a municipality. So they take all of our calls, including during regular business hours. So anyone that needs to reach the shelter would need to go through 311 first. And we do not have a veterinarian on staff, but we do have a contracts with several veterinary hospitals, one being a 24-hour local veterinary hospital that handles our emergencies. So it is important to give your fosters a good foundation. So we want to make sure we provide them adequate training and proper communication. So we do have comprehensive foster care handbooks that go out with every foster parent, and they are provided digitally, but we can give a printed copy if needed. So they are species specific. We want to make sure that we have quick reference guides so they can find the information easily, including our contact information and our emergency protocol. So just some examples, we do have FAQs throughout the foster handbooks. And with the digital copies, they can just click right on the links and it will take them right to the appropriate section in how to contact us in an emergency. So what is an emergency? We do try to put some guidelines in the guide and in our training so that the foster parents have some idea when they need to reach us after hours, or if it is something that they can wait until the following business day. And with those quick reference guides, we want to make sure that our contact information and emergency protocol is there as well. So everything's quick and easy to find.
Seriously?
So how does our process work? So we do always have either an RVT or supervisor that's on call 24/7 throughout the year. The role of 311 is basically just to connect the foster parent with whoever's on call. So again, because 311 answers all of the city's calls for all departments, they're not set up to triage these calls or to give any advice. They're really just to connect the foster parent with whomever is assigned to take those calls on any given day. And part of the reason we do that is we don't want to be publishing our cell phone numbers. Those are used mostly internally, right? So we don't want to be giving those out to foster parents. So that's just a way to connect the two dots. Our partner vet, again, you can see on the left-hand side there sort of what our protocol is, but in the case of an emergency, we always instruct our foster parents to call 311. Be very specific that they are fostering a pet for the animal shelter, because sometimes there can be a disconnect. So we want to make sure that they're identifying that they have an animal from our shelter and that they do have an emergency and need to speak to the on-call RVT or supervisor. And then 311 will patch the call right through to our cell phones. In rare instances, if there was ever a problem where they couldn't reach us for some reason, then they can direct the foster parent to go directly to the 24-hour emerge hospital in rare instances that they couldn't get a hold of us. So when we receive the calls, we basically can triage most things. 9 times out of 10, the foster parent doesn't require after-hours care. A lot of times it's just talking them through something or, arranging to see them the next business day. But in true cases of emergency, then we can direct them to head right to that veterinary hospital. When the foster parent is on their way to the hospital, then of course we contact the veterinarian to alert them that someone is on the way with one of our animals and make sure that they know how to reach us for any medical decisions or authorizations. And we do have our animal control officers. There's always one of them on call as well. So in cases where a foster parent maybe doesn't have access to transportation, we can involve them as well to transport the animal. Or if there was some sort of behavioral issue after hours, like a severe bite or something like that, then we can send the animal control officer to attend. So some things we are looking at adding. We want to look at adding a Facebook group for peer-to-peer fostering support, just another layer of support for those foster parents to reach out, especially if it's not an urgent concern. And we are looking at adding fridge magnets so that we can put all of that emergency protocol and contact information so it's nice and handy. Something to keep in mind, most of our staff that are on call are at least a 1 hour drive away from the shelter. So in true cases of emergencies, it's really helpful to have that partner vet so that there's no delay in the animal receiving treatment. So some of the challenges that we have run into is, again, miscommunications between the foster and either our 311 call center or the veterinary partner. So again, just being very specific and explaining that they do have, they're fostering an animal for the shelter. Sometimes there's a disconnect and 311 will think that it's just a member of the public calling about their own animal, and then they'll just direct them to call their own vet. So we need to be very specific in the verbiage that they need to use. Sometimes as well with the veterinary hospital, it is quite large and there is a lot of staff turnover. So we have run into issues where maybe new staff are working and they don't necessarily know the protocol. So they might have a foster parent attend there and then start asking them for authorizations or treatment decisions. So again, very important that all parties know the process. And of course, it can be costly if we have foster parents that are just going directly to the vet without touching base with us first, or authorizing treatments, outside of what we would do. So very important to make sure everything is in place. Some of the benefits of this, I mean, initially I've been at the shelter for 12 years and initially I was doing more regular on call and heading into the shelter for most things. So it's definitely providing a quicker access to care for our foster parents because they're not having to wait for me to drive an hour into the shelter. The fosters feel more supported because they have all of these avenues and the knowledge with the guide. It is a good work-life balance and minimizes stress and burnout for our staff as well to make sure that we are doing a rotation, right? That you're not just having one foster coordinator that's fielding all of the calls and giving out their personal information.